Hi, this video is about the PLAB 2 exam, the exam that you take after PLAB 1 and your final part of your PLAB assessment run by the GMC to see whether you can work as a doctor in the UK when you're from various parts of the world. I'm Aman. I'm a GP and a medical educator based in the UK, and I'm passionate about getting you through your PLAB exam. Let's have a look. So PLAB 2 is an OSCE-based exam taken at the GMC building in Manchester, and it can be taken at various times throughout the year. There's 18 stations in this exam, and each station lasts 8 minutes each, with a minute-and-a-half break between each station. You get 2 rest stations in the exam, and in total, you're looking at about a 3-hour, 10-minute exam time. Now, as with the PLAB 1 exam, it's testing to see whether you'll be able to deal with some of the issues seen by a UK-trained doctor who's just about to start their Foundation Year 2 program. It's not based on fact recital and memorization. It assumes you have certain levels of knowledge having cleared PLAB 1. It's now looking to see how can you apply that knowledge in various situations that you might see as a doctor in the UK, whether it be a mock consultation or whether it be a ward-based situation. Now, when you're preparing for PLAB 2, it's important to remember that you're thinking about UK current best practice. There may be different protocols that you use in certain parts of the world, but this is testing you on UK best current practice, so bear that in mind when you're preparing and when you're practicing your role plays and situation scenarios. Now, in terms of marking for this exam, PLAB 2 has changed recently, so I've examined both in the old system and the new system. So I'll talk about the new system and how it's currently marked. So you have 3 main areas where each case is marked: data gathering, technical and assessment skills, clinical management, and interpersonal skills. Now, for each of these 3 domains in each case, you will get a grade from A to E, A being excellent and E being severe fail. And we'll go through these 3 main domains in a bit more detail. So for data gathering, technical and assessment skills, essentially it's looking at things like your history taking, your examination skills, your practical procedures, and any investigations that you might think about, essentially when you're gathering data to try and work out what a potential diagnosis might be in a patient. Now, in terms of examination, there could be a variety of ways this is tested. It could be on real life actors or role models, it could be on anatomical models, and it could be as part of an electronic simulated mannequin. Common things that are tested include common everyday examinations, things like cardiovascular, respiratory, abdomen, various joints. Some things that can be tested on models include things like breast examinations, eye examinations, rectal examinations, bimanual things. These are things to think about when you're practicing and preparing for examinations. Some examples of practical procedures that may be tested are things that you might come across on a typical ward in the UK: measuring blood pressure, taking blood, urinary catheterization, inserting cannulas, suturing, calculating common drug doses. These are common things that would be worth thinking about when preparing, and there's a whole list of things that you might find in the PLAB blueprint. So the second domain of clinical management is essentially looking to see, now that you've got the data on board, how do you manage that situation, both clinically and maybe non-clinically in certain scenarios. Things like, if you've come with the correct diagnosis, how do you explain that diagnosis to the patient? How do you involve the patient in a correct, safe, appropriate management plan? Are you using UK current press guidance in the way that you're dealing with this situation? So essentially it's looking at, you've gathered the data in the first half, now how are you managing it, and is it appropriate for working as a UK junior doctor? And the third domain of interpersonal skills is essentially looking at a variety of ways in which you manage the patient and manage the situation. So things like, do you involve the patient regularly? What's the rapport like between you and the patient? Are you using good use of open and closed questions? Are you thinking about ethics, things like breaking bad news, things like consent? Essentially, it's about how you manage that situation from a patient point of view, or perhaps a relative's point of view, and are you looking at it in a professional way which involves both you, the patient, and all the other various factors that are taken into account when managing the situation as a whole. So how do you prepare for PLAB 2? Now, I think it's very different to PLAB 1. PLAB 1 is about sitting there, you can do it on your own, you can look through questions, you can learn material. PLAB 2 is about practice, really. And there's 2 different ways that you can go about and get practice. Number 1 is form a study group. Find people that are doing the exam and practice various scenarios looking at the blueprint. Some people take this approach, but by far the most common approach is to join an academy. Now, there's many academies out there, both in the UK and internationally. We run our own, but there's several others that could be useful as well. well. And academies are all about getting you through those common scenarios, making sure you understand the principles behind certain cases and learning how you can adapt to certain situations so that you can perform to the best of your abilities on the day. So joining an academy is something that a lot of people do. It's not the only way to pass PLAB 2, but it's one of the best ways of getting some practice under your belt. Mock exams are another great way of doing this. Sometimes you want to feel the pressure of the exam before the exam day. Feel what it's like to go through 3 hours of intense role play consultation practice. It's not something you may have done too often in the past, and it's useful to figure out what you need to focus on in the last few weeks, where you need to perfect and where you need to improve a little bit. So practice is really important, and thinking about academies, thinking about mock exams, thinking about study groups will be really useful in your PLAB 2 preparation. So hopefully this has been of some value to you if you're preparing for your PLAB 2 exam. I'm passionate about getting you guys through the PLAB process. So any questions you have, any videos that you want me to make about the PLAB process, please get in touch. My details should be down for there. If you found this video useful, please think about subscribing to our YouTube channel. We'll put up regular PLAB training videos in the future. We've got a lot of online training and we've got our academy, and hopefully we'll get to meet some of you guys going forward. We've also got our Facebook Arora PLAB training page, so search that up if you want to have a look at some regular revision tips and postings and videos. We have our Instagram page for Arora Medical Education as well. Either way, hopefully we'll get to connect at some point going forward. Hope this video has been useful. Take care.